Are you currently suffering from groin or hip pain and not sure which tissue or muscles are causing your pain and whether you should rest it or exercise? With groin or hip pain, it can be very confusing initially, and unfortunately it can become nagging or persistent. But luckily, with a few simple questions and tests, we can both accurately and efficiently depict what tissue is causing your pain and then the best exercises to fix it. And for those that don't know me, my name is Dr. Zach Greenway, and our channel is all about empowering you through exercises, education, and ways to self-manage your condition. We're going to cover the 5 most common causes of hip pain, starting with the ball and socket or the hip joint itself, then the hip flexor muscle, the adductor muscles, the pubic symphysis, which is where the 2 pelvic bones attach in the front of your pelvis, and then the abdominal muscles. And we're going to show you the ways to diagnose it accurately and efficiently, and then the best exercises to rehab it. With exercises or rehab, it's all about finding the right entry point for your current fitness level and symptoms. So we're going to give you several levels, starting with easier ones and then progressing to more advanced ones. So it's really important that you start at the right level and take the time that's needed and progress appropriately, and don't rush and go too quickly. The hip joint, or that ball and socket joint where your thigh bone or the femur attaches to your pelvis. Some important things to note is that this is very uncommon in anyone under the age of 35. You just haven't lived enough life to irritate that joint yet. However, if you have a limp or you walk around with a limp or pain, it greatly increases the chance that your hip is causing your pain. A couple orthopedic tests are the Fader test, which checks for internal rotation and pain, and then a lack of internal rotation. Also, it seems like family history is really important here, so it's important to see if your parents or anyone else had this issue. For the hip joint pain, we actually can't affect the joint itself, but we can strengthen the muscles around the joint to protect the joint. So we're going to address both the hip flexors, the abductors, the adductors, and then the hip extenders. Level 1, hip flexor. So if this is the hip that's causing me pain, I'm going to bring my leg up to a 90-90 and place both hands on my knee. And then I'm going to press my knee up into my hands to tolerance. Some mild discomfort's okay, but it should not be painful. And we're going to hold for 10 to 20 seconds. Level 2, in that same position, we're going to straighten the knee of the affected leg, and keeping that knee straight and that ankle in neutral, we're going to raise our leg as high as we can, pause for 2 seconds, and then return to the starting position slowly. Again, you want to feel tension in the front of that hip. So again, keeping that knee straight, lift it all the way up, ankle in neutral, pause for 2 seconds, and then return to the starting position. Level 1, hip extension. So laying face down with your knees straight of the affected hip, we're going to raise our leg up with our buttocks, hold, and then return to the starting position. Again, make sure to feel tension in your hip or buttocks and not your low back. Some tension in the hamstring is okay, but we really want to make sure that your buttocks is doing the motion, and only lift as high as your hip can do. Don't twist the back. So again, lift up as far as you can, control, return to the starting position. Level 2, hip extension. Laying face down with your knees straight, place a band around your ankles. Using your butt, lift your leg up towards the ceiling, hold for 2 seconds, and then return to the starting position. Keep the knee straight and make sure you use your buttocks and not your back. Level 1, hip abductors. Laying on your side with the affected hip up, bend the bottom leg and keep the top leg straight with your ankle in neutral. Make sure to keep your leg in line with your low back and raise your leg up to the ceiling to tolerance, and then return to the starting position. Again, make sure to feel tension in the back of the buttocks, not the front of the hip. Some people want to bring their leg forward, so really make a conscious effort to keep your leg back. Now, if it's really challenging at first, you can only go a little bit, or you can bend your knee a little bit to make the lever arm shorter, and then raise, and then over time, increase the knee extension. Level 2, put that band around your ankles, keep both legs straight, and again, in line with your back, and then using that buttocks, raise your top leg up to the ceiling to tolerance, and then return to the starting position. Again, make sure to go straight up and don't let that leg swing forward. Level 1, hip adductors. So laying on your back with your knees bent, place that ball or cushion between your knees and then pressing inwards with your knees into that ball, hold at tolerance. Again, feel tension on the inside of your thigh muscles. Level 2, hip adduction. Sitting down with your knees straight, place a ball between your ankles, and then you're going to press inwards with your ankles into the ball, and then hold for 10 to 20 seconds for the tolerance. Feel tension on the inside of your legs and increase over time. So for the hip flexor, it's most commonly seen in sprinters or weightlifters, but it's also seen in people that do multi-directional sports or kicking. One caveat to note is that this is really overdiagnosed, so it's really important to be specific and make sure that's actually your hip flexor muscle that's causing the pain. Your pain should be over this area, as we show you here, the hip flexor muscle, and then stretching that muscle or doing a resisted muscle test should reproduce the pain that you're experiencing. For the hip flexor, we're going to give you two versions, one without a band and then one with a PT band. So in case you don't have the band, you can just use your body weight and your legs. So level one is a seated leg raise. So on a bench or a seat with your knees fully straight, using your arms to support, we're going to raise one leg up to the ceiling, feeling tension in the front of the hip, down, and then repeat on the opposite side. When you're doing this, make sure not to lean at all or compensate, and try not to bend your knee at all. So it's just the knee is straight, raise your leg up and down. Now that might be too challenging initially, so you might want to bend your knees a little bit and then raise. And again, you can keep your knees bent, but you gotta make sure the motion is coming from your hip joint, not your knees or your low back. So level two will be in a seated position on the floor with your knees straight and your hands behind to brace you. Again, we're gonna use our hip joint to lift our leg up towards the ceiling and down, and then repeat on the opposite side. The same rules apply, so try not to lean at all, either forward or back with your back, and make sure the tension's in the front of your hip with that hip flexor muscle, and try to keep your knee as straight as possible and your ankles in a straight position. Banded version level one. So in that same seated position, put a lightweight PT band around your midfoot, keep your foot about shoulder width apart, and then pull one foot up towards your chest using your hip flexor, and then repeat on the opposite side. Again, try not to tilt your torso at all, and use a lightweight PT band, and then progress to level two when you're ready. Level two, so laying on your back with that PT band around your midfoot, bring your hips and knees to a 90-90 position, press one leg out as far as you can, return to the starting position, and then press the other leg out. Try to keep your pelvis from moving and feel that tension in the front of the hip flexor and get your heel all the way down to the floor, slow and controlled. So level three is standing. So with that PT band around your midfoot, you can be close to a wall or a base of support. Put one hand on that wall lightly, lift one leg up as high as you can, try to tilt as little as possible, and then repeat on the opposite side. Again, really make sure you feel that tension in that front of that hip, and as you lift your leg up, try not to lean back at all. You want to feel the tension in the hip, not your back. And then level four is going to be ballistic loading. So against the wall with that PT band on your foot, we're going to rapidly lift our leg up to get the hip ready for sprinting and running drills. Again, you want to make sure that motion is as fast as tolerated, and you can increase the band to make it more difficult. The adductor muscle group. So these are most commonly seen in multi-directional sports, and your pain is here. That's the image that we show you. Palpation of the muscle or tendon should reproduce your pain, and the best test for this is the adductor squeeze. So you're going to lay on your back with your knees straight, and have someone put their forearm between your ankles or put a foam roller between them, and you're going to squeeze very hard inwards for 10 to 20 seconds. If this reproduces your pain, it's your adductor muscle group. Level one, ball squeeze. So laying on your back with your knees bent, place an exercise ball or a pillow or a cushion between your knees, and then you're going to press inwards with your knees and hold for 20 to 30 seconds or to tolerance. Try to increase the intensity of the squeeze over time. Level two, hip adduction. Laying on your back with your knees straight, place a ball or a cushion between your ankles. Press inwards with your legs into the ball and hold for 10 to 20 seconds or to tolerance. Make sure to feel tension on the inside of your legs and increase the intensity over time. Level three is the short lever Copenhagen hold. So what you're going to do is laying on your side with a bench or a box, you're going to get one leg up with your knee bent. Keeping your elbow under your shoulder, we're going to lift up and feel tension on that inside leg and then hold to tolerance. This is quite challenging, so you want to start slow and then progress over time. Level four is the long lever. So in that same position, but now with your knees straight, we're going to keep our elbow under our shoulder, lift up, and then hold the tolerance. Pubic symphysis. So this is the front part of your pelvis where your two pelvic bones attach. And a couple important things to note is this is much more common in people under the age of 25 before their skeleton has fully matured. Normally the pain is more midline than the other conditions, and sometimes it'll switch side to side. But again, palpating this area, as we show you here, should reproduce your pain. Level one, laying on your back with a PT band around your legs just above your knees. We're going to press out with our legs and then hold for 10 to 20 seconds or to tolerance. Level two, in that same position, we're going to press our legs out, but as we keep that, we're going to lift our hips up with our buttocks and then hold the tolerance, maintaining that tension outwards with the knees. Level 3, in that same position on your back with your knees bent, place that ball or cushion between your knees, press your legs inwards into that tension of the ball, and then lift up with your hips as you maintain tension into the ball and hold the tolerance. Abdominal or inguinal. So your pain should be reproduced with coughing, sneezing, or bearing down. Your pain should be reproduced by palpation. Your pain is probably over the area of this picture that we show you here. And some people may have a bulge, which is a hernia. That's a medical condition that should be assessed separately. Level 1, laying on your back with your knees bent, we're going to take our arms straight and place them on our thighs. And then using our core muscles, we're going to crunch up and slide our hands up to the knees, only to the side of pain. As soon as you feel pain, you're going to stop and return to the starting position. Again, make sure for tension in your core, the front of your stomach, not your neck. You want to just use your core to lift you up. And again, this should be painless. Level 2, in that same position, we're going to take our hands and cross our chest, grabbing our opposite shoulders. And then again, using our core, we're going to crunch up to the onset of pain and then return to the starting position. Make sure to feel tension in the front of your core or your abdominal muscles and not your neck. Try to increase the range of motion over time, but again, this exercise should be painless. Level 3 is the knee plank. So have your forearms on the ground, keep your knees on the ground, lift your heels up, drop your butt in line with your shoulders and your hips, and then hold the tolerance. Again, there should be no pain with this exercise. Level 4, in that same position, we're going to put our feet on the floor, lift our knees up, and hold a plank for as long as tolerant. Again, there should be no pain in this, and you should feel tension over your core, buttocks, and back. Thank you for watching our comprehensive video on groin pain. I promise you, if you follow this specifically, it'll tell you what's causing your pain and then how to fix it. If you did find this beneficial, please like our video and then don't forget to check out our awesome other videos on our channel.